Ready to learn more about the open enrollment period for Medicare? Hi, I'm Jared with Carlin Financial Group. For the best retirement information and to help make sure you don't outlive your money, be sure to subscribe to our channel and hit the bell to be notified when we release new videos. Medicare has many different enrollment periods, but in this video we'll take a look specifically at the enrollment period that current beneficiaries have the opportunity to use every year, when it happens, what it means, who it applies to, and why it's important. Medicare's open enrollment, or AEP, the annual enrollment period, occurs every year from October 15th to December 7th. This is when current Medicare beneficiaries, as in those who are already enrolled in Medicare, can make changes to their coverage. This election period applies to those who are enrolled in original Medicare, a Medicare Advantage plan, and/or a standalone prescription drug plan under Medicare Part D. If any of those describe you, you will have the opportunity to shop around and make changes. What kind of changes? Well, that depends on your current coverage. For your healthcare needs, if you have original Medicare, you can change to a Medicare Advantage plan. If you're currently enrolled in a Medicare Advantage plan, you can change from one carrier to another, change from a Medicare Advantage plan that doesn't include prescription drug coverage to one that does, or vice versa, or you can return to original Medicare. If you do elect to return to original Medicare, you could then choose to enroll in a Medicare supplement, also known as a Medigap plan. For prescription drugs, in most cases, if your plan doesn't include drug coverage or you're on original Medicare, you can join a Part D standalone drug plan. You can switch from one plan to another, or you can drop your prescription drug coverage altogether. Now, all of the changes made using this election period will take effect January 1st of the following year. It's important to know that if you're not already enrolled in Medicare, then this is not the enrollment period for you. If you want to enroll in Medicare Parts A and B and you're not in your initial enrollment period, then you'll need to wait until the general enrollment period, which runs January 1st to March 31st. Now, to get back to the annual enrollment period, let's say you decide to leave a Medicare Advantage plan and you choose to enroll in original Medicare and choose a Medicare supplement or Medigap plan, as they're sometimes called. You should be aware that you will need to answer health questions and go through medical underwriting with the carrier to determine if you're eligible to purchase the additional coverage. The only way to avoid that underwriting is if your initial enrollment period happens to coincide with AEP, or if you qualify for a special election period that would allow you to enroll in a supplement with a guaranteed issue right. The Medicare annual enrollment period does not grant you that right on its own. And while you can add or change Medicare supplement at any time of year, you're only able to enroll without answering health questions and going through underwriting under the circumstances that we just discussed. It's always a good idea to review your current coverage each year to make sure it still fits your needs, since it's not uncommon for drug formularies to change, for Medicare Advantage plans to change, or even possibly be eliminated from year to year. Each year, your current Medicare Advantage or Part D carrier is required to send you an annual notice of change letter. That'll give you a summary of what you can expect in the way of any changes that the carriers plan to make for your current benefits in the coming year. The potential changes most people want to be aware of can include changes to doctors and hospital networks, drug coverages and formularies, and premium charges. You'll want to be sure that if you have a Medicare Advantage plan with network providers, that your doctors and preferred hospitals, etc., are still covered. For your Part D or prescription drug plan, it's important to verify that you'll still have access to the prescriptions you may need as part of that plan's formulary for the coming year. If you discover your doctor is now out of network, your premium increased more than you expected, or your drugs may not be covered in the new formulary, this is the time for you to make changes for the coming year. Remember, you have got a limited time frame in which to accomplish this, so it's important to be diligent and make sure you still have the coverage you'll need for the new year when it comes around. Many people get complacent and just assume they can maintain whatever current coverage they currently have and they'll be just fine. Unfortunately, that is not always the case, and there may not be a simple remedy should you end up in a bind. So you want to be sure to review your options while you've got the opportunity. If you've got more questions, please drop us a line down below and we'll do our best to get those answered for you in a future video. I hope this video helps you develop a better understanding about Medicare's annual enrollment period and the options that you have during the time from October 15th to December 7th each year. You can always find out more about working with us and apply to become a client by clicking the link down below in the description. Thanks for watching today, and please share this video with a friend that you think it might be beneficial for. Give it a like, and be sure to subscribe to our channel and hit the bell to get all of our latest tips. As always, live today, plan for tomorrow.